Hi, Dr. MovingBetter. My neck pain shoots into my arm and 2 fingers tingle. Is that a pinched nerve?
Hello, Sarah. When neck pain travels down the arm with tingling or numbness, we think cervical radiculopathy, a pinched or irritated nerve root in the neck. I'll show you what's happening inside, quick relief setups you can try now, red flags to watch for, and treatment options if it doesn't settle.
It's sharp, sometimes burning. Looking down at my phone or turning my head makes it worse.
That sounds like nerve pain. It often feels electric or burning and follows a path into the arm or fingers. Muscle pain is more achy, tender, and local to the neck or upper back. Often, an irritated nerve in the neck will cause the surrounding muscles to tighten up, as a protective means. But then you experience the spasms from the neck muscles and nerve pain shooting down your arm.
What's actually happening inside my neck to cause that?
Think of the nerves in your neck like wires that travel out to the arms. They exit through small tunnels between the bones. If one of those tunnels gets narrowed, maybe from a bulging disc, arthritis, bony spurs, or even just swelling from inflammation, it can pinch the nerve root. That irritates the nerve, and your brain feels it as pain, tingling, or weakness in the muscles the nerve controls. Your body responds by having nearby muscles tighten up to try and protect the wounded nerve.
Is that why I feel it in my first 2 fingers?
Exactly. Just like wiring, nerves control specific muscles. For example, if the C6 nerve is irritated, you notice symptoms in your thumb and index finger. C7 goes to the middle finger, and C8 to the ring and little finger.
Why does it get worse when I'm looking at my computer screen or when I look down at my phone?
Because position plus time matter. Looking down or sitting slouched for too long subtly closes the tunnel and tugs the nerve. Even a good posture, if held too long, becomes a problem. Small pressure multiplied by long time equals a flare. But there is good news. With space, movement, and time, most irritated nerves calm down. Your job is to create nerve-friendly conditions.
Is there anything I can do to manage this pain on my own?
First, support the arm. Prop it on pillows or the arm of a chair so the nerve isn't hanging under tension. Second, posture check. Ears over shoulders, screen at eye level, elbows supported. Third, gentle movement only. Small chin nods and shoulder blade squeezes, but stop if the pain shoots or tingles more. Heat or ice can help with muscle spasm along with gentle stretches, but none of that fixes the nerve.
Thank you. I tried that and it eases it a little.
That's the nerve liking unloading. You gave the wire slack.
I've corrected my posture while sitting, but the pain still returns. Why?
Because no posture is perfect if you freeze in it. The nerve gets irritated less by a single bad position and more by staying still. That's why I recommend a reset every 30 to 60 minutes. Stand and walk for a minute. Do a few chin tucks, then gently nod your chin, like a tiny yes. Squeeze your shoulder blades back and down a few times. And keep your computer screen at eye level with elbows supported.
You mentioned chin tucks. I've heard of those. What's so important about them?
The immediate benefit is correcting forward-leaning posture that can bring on the pain or worsen it. Chin tucks also help alleviate symptoms of cervical radiculopathy by strengthening neck muscles, improving posture, and reducing strain on the cervical spine. They can also enhance flexibility and relieve tension in the neck, which may lead to decreased pain and improved function.
Thank you for explaining that. Is there anything I can do to help me sleep better?
I feel you, Sarah. Night pain is rough. Try side lying with your neck level on the pillow and hug another pillow so your arm is supported. Many patients feel relief right away because the nerve is unloaded.
Thank you, Dr. MovingBetter. Is there anything I should watch out for?
Yes, there are some red flags. If you notice these, get checked right away. Any new onset nerve pain, new or worsening weakness, numbness that doesn't let up, severe or rapidly worsening pain, fever, night sweats, or unexplained weight loss, recent significant trauma, osteoporosis or infection risk, balance problems, clumsiness, or changes in bladder or bowel control.
Wow, that's a lot of information.
No worries, Sarah. To keep this simple, I made a free one-page red flags and positioning checklist. Print it, tape it to your desk or nightstand. You can find the link in the description or pinned comments.
What if I try everything you recommend but it doesn't settle? What are my options?
Here's the full roadmap. First, we start with conservative care, activity modification, and posture habits. Physical therapy is good for mobility, graded loading, and mid-back strength. Sometimes supervised cervical traction can help. That's best done with a physical therapist for safety, to see if you're a good candidate and to monitor your response. If symptoms persist or the exam changes, your doctor may order imaging like an X-ray or MRI. Second, adjuncts when needed, short-term medications if safe for you, injections to calm stubborn inflammation so therapy can progress. These are tools, not cures. Third, escalation. If symptoms persist or the exam changes, your doctor may need to do more imaging. Surgery is the rarest step, usually only for progressive weakness, significant neurologic loss, or disabling pain that fails conservative care.
Does that mean most people improve without surgery?
Correct. Surgery is the exception, not the rule. Most calm down with structured conservative care.
It's good to know that you don't always have to get surgery for this, but how long until this truly improves?
Expect days to weeks for irritability to settle, not hours. Overall results we see in 4 to 6 weeks. As flares shrink, we add strength, especially mid-back and shoulder blade control, to protect the neck long term. Your body is built to adapt. Give the nerve space and time, and it helps.
This finally makes sense. What to try, what to avoid, and when to get help. I'm going to download the red flags and positioning checklist. Thank you, Dr. MovingBetter.
You're welcome, Sarah. That's our mission at Rehab Lab. Science-backed recovery made simple. If this helped, like, subscribe, and share it with someone who needs relief today.